We go inside your health now. There's a condition, it's called POTS, and it affects nearly 1 million people each year. Most people who get it are women. This condition has been identified since the 1930s, but the COVID-19 pandemic seems to have really doubled or even tripled the number of people who are diagnosed with this. For some, POTS can really be debilitating. We have our KSTP medical expert, Dr. Arkel Georgiou, here now to take a deeper dive into this condition. I got to be honest, when you talked about it this morning, I thought, POTS? I don't even know what this is. So tell us about what this condition is and just start with the basics for us.
Sure. So POTS stands for POTS, Postural Orthostatic Tachycardia Syndrome.
Okay.
And what that means is when people change their posture, when they go from lying to standing, their heart rate increases by at least 30 beats per minute. If you're an adolescent, the diagnosis means that your heart rate has to go up by at least 40 beats per minute. That's uncomfortable for someone. So you can see in the graphics there, you go from lying to standing, and so your heart is pumping so quickly, and it stays there. It doesn't normalize back. So your body's really exerting itself, and the symptoms, people can feel lightheaded, they can faint, they have like brain fog, they have fatigue, and it can last for a while. I mean, each episode can last for a while, and the symptoms can be chronic.
Okay, so it's not just having a little head rush. There are some more serious symptoms and some risks involved with this.
Right. So the risks, I know that it sounds really serious, and it's certainly a quality of life issue. The biggest risk is if someone has this event and they faint and they fall and hit their head. The most common symptom is what I said earlier, which is just not feeling well, feeling lightheaded, and it's a quality of life issue. But the reason I really wanted to talk about it today, Leah, is that while it's not going to kill you, this condition isn't going to kill you, but it takes so long to diagnose people, primarily women, who have it. On average, people have to wait 2 to 5 years to get diagnosed. It's brushed off a little bit, the symptoms are vague. Studies show that women generally see 7 different doctors and have 9 emergency room visits before they are diagnosed. So I think raising awareness around this is really important.
Awareness for patients, awareness for doctors too. Do doctors not think to look for it very often?
It's vague. Right?
Yeah,
and
vague,
so you get a lot of tests on,
Yeah.
and it's not that hard to diagnose as long as you make sure some other conditions, heart conditions, are not causing it, but it's not common.
And since COVID-19, since the pandemic hit, more people are in fact being diagnosed.
So many more people, and you shared the statistics earlier, 2 or 3 times more. And the reason, we think, is that we've known for many years that POTS can be triggered by any type of viral infection. And the reason is that when you have a viral infection, you are taking it easy, you're laying down, you're getting a little deconditioned, and so it triggers this problem in people who are susceptible to it. So we've known that COVID-19, we understand the mechanism, and it's a virus just like anything else.
Okay, real quickly here, how is it treated if this is something people are dealing with?
So certainly there is a small group of people where it can be debilitating. Fortunately, that's not the majority. The majority of people can deal with it with lifestyle changes. One is making sure you stay hydrated. 2, this is a time when increasing salt in the diet is healthy. Exercise is important, but if you start doing that, make sure you do it while you're sitting down. Don't start standing because your body doesn't like that. Compression, socks, usually athleisure wear will work, or even like Spanx shapewear can help, because what happens is blood is pooling in the lower half of the body. For people who, that isn't making them feel better, then medication, which decreases your heart rate, will help those folks.
Something we can do. Dr. Arkel Georgiou, thank you so much. Paul?